A new procedure pioneered by a doctor in Colorado could change the way cranial surgeries are done across the country.
And one family is sharing their story after their baby was the second child to undergo this first-of-a-kind treatment plan.
Denver 7's Colette Bordelon shows us how she's doing tonight and why this might just be a solution when it comes to the typical recovery time.
Say hi. Say hi.
Hannah Stallings is a lot of personality,
Spicy.
wrapped up in one tiny package.
Well, she's got a lot to say. Babbling, walking, running, climbing. There you go.
Her mom, Julie, says she just doesn't slow down.
She is essentially a perfectly healthy 1.5-year-old.
And she's proud to see how far her baby girl has come.
You would never know that that was part of her story.
Hannah was born with a cranial condition,
We could tell that something was off, but we didn't know what.
and Julie knew it meant surgery on her daughter's skull.
Oh man, I was sobbing.
The family did lots of research before their initial consult.
So we went in thinking that we knew what we wanted, and Dr. Wynn said, well, I have a third option, and I'm doing the first one tomorrow.
How are you?
Their Dr. Feng Win is the chief of pediatric plastic surgery at Children's Hospital, Colorado.
This patient, she was born with something called metopic craniosynostosis. It rolls off the tongue. Something fuses before it should, and it's our job to recreate head shape and make room for the brain. That's as simple as that.
Dr. Wynn pulled from a number of different concepts to come up with a new treatment plan, a first of its kind, cranial surgery, which meant less time in a helmet that helps shape the skull after the surgery.
So we had to rethink and think outside the box. How can we do this better?
Hannah was only the second patient to undergo this minimally invasive procedure at Children's Hospital, Colorado.
It was a journey because number one was just a few weeks before her. So it was a matter of, hey, listen, this is a new thing. We just tried it. It looks great.
She was able to take off her helmet 6 months after the first consult. So that's about half the time she would have spent in a helmet if not for the new procedure.
Oh, it's been perfect. It could not have been any better.
And now Hannah is 1 year post-op and thriving.
And just to see how resilient she was, I think I had a harder time with it than she did.
A new treatment
Somebody's got to be first at some point, or there's not ever going to be anything new.
with Hannah leading the way. Colette Bordelon, Denver 7.
And the hospital is keeping track of long-term results from this procedure, and they say this will be key in understanding if this really is a superior option to other treatment plans.